Welcome to Health Matters. Today we are very happy to tell you more about Creating with Care, this creative arts program which has brought a lot of joy to people at our community hospitals. We will hear today from Emma Lever, our service director, and from Creating with Care doers, Angela Conlan and Paula Har. You can ask questions throughout this event. The questions function is on the right-hand side of your screen. And if it is not visible, you can click on the little question mark in the speech bubble and that will bring it out. And this event is being recorded. So if you have questions that were not answered while we are in the event, they will be answered later in the follow-up story online. And without further ado, I'm going to pass you on to Emma.
Thank you. Good afternoon and welcome to this Health Matters event, Creating with Care. My name is Emma Lever and I'm proud to be one of the service directors in the Community Directorate. This event is one in our series of Health Matters organised by our brilliant membership team. This one is open to all, not just to members, and you are all very welcome. We hope we can inspire you to become a member. It's free, there's no obligation, and it's a fantastic way to get involved and help us to develop our services. We have a Councillor of Governors election in the springtime, and as a member, you get to vote, or you could even stand as a governor. You can join to be a member online via our website, and we'll pop the link in the chat. Today, we're here to share a celebration of an amazing project with you, and the project's called Creating with Care. Creating with Care is an arts programme run throughout our community hospitals. Across Oxfordshire, Oxford Health run 8 community hospital wards on 6 hospital sites in Abingdon, Witney, Wallingford, Didcot, Bicester and City. One purpose of these beds is to provide a reablement facility to assist patients regain independence following acute illness or trauma. Creating with Care runs alongside our hospital staff to release potential in our patients and provides a real addition of joy to our wards that benefits not only our patients but our staff and families too. We are delighted that this programme recently won an award for improving care in the Community Hospital Association Best Practice Awards. I'm going to hand over to Paula now so you can see for yourselves our worthy winners.
Hello and welcome to our presentation today. I'm Paula Har and I am co-founder of the project that we're going to show you today.
Hello, and I'm Angela Conlan. I'm the Arts Coordinator for Creating with Care. I'm also a dance practitioner working in the community and a postural stability instructor. And so I thought we could start today by showing you a bit of what we would do in a hospital setting. A lot of what I do is talking to patients about dancing. And so because I can't talk to you all, I still wanted to be interactive. So in a moment, we're going to do a bit of a dance routine based on winter. So if you would like to just pop into the chat anything that you like doing during winter time, something that makes you feel happy, or it might be something that you like watching. I'm going to try and include them all in my routine in a minute, which will be good. So just before we start, if you join in only if you can, and it's okay to do so. It's going to be a seated routine, so make sure you're sitting on a nice sturdy chair and you've got nothing around you that you're going to hit. Oh, we've already got a couple of things: warming hands on the fire and ice skating, lovely. Anything else? And we'll take it from there, really. No, I'm just gonna, something else, hot drinks. Can we have mulled wine? Oh, and throwing snowballs, brilliant. Okay, so we are, I'm gonna take my chair back a bit so that you can see what I'm doing. And if you you'd like to join me, that'd be lovely. I can't see you, so you can really go for it. So we're going to start by just giving yourself a little warm, rubbing your arms and in time to the music. So that's for a count of 8. Then I think someone said ice skating. So we're going to make a figure of 8, like we're beautiful ice skaters with our arms. So figure of 8 with your arms for a count of 8. Then we're going to go skiing, like this. And to make it exciting, we'll ski for 7, and then on the 8, clap. We've got warming hands on the fire. Lovely. Bit of that. Then I think we'll have a bit of a celebration because we've got our hot drink. It was a mulled wine, wasn't it? So we can drink it like that. Lovely. And then we'll throw a few snowballs. So I'm going to put some music on, and you can either watch me or join in, and hopefully you're all at home joining in. The music I'm going to play is from one of our artists who's a regular in our community hospitals, particularly before COVID, but we have done virtual visits from them, and this is the Mary Lou Review singing It's the Most Wonderful Time of the Year. So get ready to start with those 8 hugs.
It's the most wonderful time of the year.
Yeah.
With that kid jingle belling and everyone telling you be good cheer.
7, clap,
It's the most wonderful time of the year. It's the happiest season of all. With those holiday greetings and happy meetings where friends come to call. It's the happiest season of all. There'll be parties for hosting, marshmallows for toasting, and caroling out in the snow. There'll be scary ghost stories and tales of the glories of Christmases long ago. It's the most wonderful time of the year. There'll be much mistletoeing and hearts all aglow as loved ones in need. It's the most wonderful time of the year.
Lovely. So that gives you a little bit of an idea of how we might build a dance routine up if we had a group of people, or even if I was one-to-one at a bedside, and how we would perhaps have quite a long time discussing music first before we got on to movement. And it might be me doing the movement all on my own with the person watching, or it might be that we do some very small movement using hands or just feet. It's very bespoke to whoever we're working with. So I'm going to hand over to Paula now to start the presentation.
Hello everybody, thank you Angela for that. That was a lovely introduction to what we're going to bring through in the presentation today. So I'm Paula Har, and at the time Creating with Care was founded, I was working at Whitney Community Hospital. And before Creating with Care, if we have the next slide please, Victoria. The activities that were happening then were really dependent on the patient pathway, and there was nothing at that time that was completely all-inclusive. So it was really the patients that had come in on the stroke pathway. It would be the stroke therapist would work specifically with those patients, or it would be physiotherapists or occupational therapists would be working with other patients as and when they needed that particular therapy. So it was quite difficult, and you'd often see some of the patients not understanding why they wouldn't be included in a particular activity. And that's where and how the idea for Creating with Care was formed. West Oxfordshire District Council approached us, and they wanted to install a piece of art in the garden or in the hospital. And actually, following lots of discussions, it was actually a really good opportunity to take that forward. And that's how Creating with Care was born, and they agreed to fund an artist to work with the patients for a year, and also to have that year evaluated. And yeah, that's how Creating with Care was born. We haven't really looked back since. So if we go to the next slide, please.
My work before Creating with Care focused on delivering dance sessions across a number of care homes and also with youth groups. So when I saw the opportunity to develop the programme at Witney Community Hospital, I was confident that dance as an art form could transform a hospital stay for patients, but also be really relevant to staff wellbeing. I often talk about a study that suggested that thinking about dancing releases endorphins to make people feel happier, even when they're not moving. And I've since seen how this works from working one-to-one with patients, where we talk about our dancing days, we play music, we reminisce without even moving, and we both feel happier afterwards. From Creating with Care, I've also had the chance to become a staff governor for the Trust, and also taken part in collaborations with ArtLink, who is the arts programme at Oxford University Hospitals, working through dance on the trauma ward at the JR, and also on some of the wards at the Horton Hospital. Next slide, please.
So during the first year, the West Oxfordshire District Council wanted the programme evaluated. So we were joined throughout the first year by Dr. Kate Hamlin from the Department of Age and Population, and she joined lots of activities. We held focus groups, she joined us in garden activities, in group activities, and there was also focus groups that were held for staff and for carers of the patients as well. So we looked at lots and lots of different areas. We captured patient feedback, we captured patient self-assessment of how they were feeling after activities, and then there was also that independent observations that were also carried out. So it was quite an intense year, but actually the successful outcome and the increased well-being that was captured and evidenced during that first year enabled West Oxfordshire to fund the programme for the second year. And, you know, if our patients are vulnerable and we are in hospital, and we have to really think about what we do and why we do it, and ensure that actually what we are doing is best practice, and that what we are doing is actually leading to an improvement in well-being. And during the end of 2017, which was the end of the first year, there was a creative health report that was published, which was an all-parliamentary document that was published, and that looked at evidence from all around the country. And actually the outcomes that we were seeing in that document was also very much reflected in the outcomes we had found. So we were actually reassured that actually all the wellbeing scores and everything and the activities that we were producing for the patients was actually indeed best practice. And not only were what we were doing was best practice, but actually we had such a variety which wasn't really reflected in the report. A lot of the evidence that was in the report was really focused on one particular activity. So we had a greater opportunity to improve well-being simply by the variation in the activities we were providing. Next slide. So along with the activities, there's lots of other things we have to think of, and on the surface they all look, you know, quite fun. However, we have to think about how we include the patient, how that co-production of especially with things in the environment, how, you know, the patients will have opportunities to decide and design the artwork that goes on the walls. They also have an opportunity in terms of placement. And actually, if you think about our community hospitals, they don't sit outside of our communities. They're very much in the centre of our communities. And actually, their family and their friends are able to see the work that they have co-produced as well. Next slide, please.
So I'm going to talk a little bit about the impact of Creating with Care over the past 4 years. So the programme itself, as Paula said, was expanded in January 2019 from being established at Whitley Community Hospital to the 5 additional community hospitals that Emma spoke about at the beginning. We continue to go from strength to strength. We have sessions in photography, art, mosaics, dance, music, vintage cabaret, drama, poetry, even a bit of Shakespeare. So this puppet here that you can see on the top right hand corner of your screen, there's William Shakespeare, and we're reenacting Macbeth in 45 minutes, which was quite fun. So many of our patients have enduring and complex conditions. We want them all to be involved, and we try and be as inclusive as possible in all our sessions. Creating with Care has had a total of 4,350 patient attendances at art sessions across our community hospitals, with 1,666 staff attendances over the past 4 years. We've also raised just under £40,000 through running concerts in the community, funding applications to our charity, but also to places like John Lewis and Waitrose. And we're continuing to look at how to develop this in the future. Next slide, please.
Sorry about that. On the surface, a lot of our activities, from people looking, they are a lot of fun. However, behind every activity, there's also a lot of work that goes unseen. So a lot of the activities, Angela's busy writing funding applications because there is a cost element also to all the activities that are held within the hospitals. Additionally, again, there's a lot of things that we have to consider. Some of the things we have to consider are infection control. We have to think about risk and safety of our patients. The safety of our patients, has to come first. And in terms of infection control, even on the day of a planned activity, there still needs to be a further additional assessment to ensure actually nothing's happened to the patient in terms of, has there been a change in their infection control status, or, is there anything happening on the ward that would make the activity that day unviable? We have to think about the risk in terms of risk management, risk safety, risk management to staff and to any of the carers also attending. And that all has to be clearly planned and documented. However, there is an element of positive risk taking that we need to consider as well. And if we go to the next slide, please. And if you think, this is Roxy and her handlers, Bearhoof company, and Roxy is a rescue horse, and actually thinking about it on paper and having to put the risk assessment on paper, you wouldn't think that actually bringing a horse onto the second floor of a hospital was necessarily a great idea, but actually the benefits do outweigh the risks, and obviously everything is carefully managed. And on the day, Roxy was able to use the lift and join patients for afternoon tea on the ward. And it was just fabulous to see. She had a celebrity welcome from all the staff and the patients. There was staff in the corridors, just absolutely amazed. It was a real buzz and vibe that was emanating around the hospital this day. And one of our patients actually had spent his life working with horses and had now moved to living in a care home, and actually thought he'd never get to see a horse again or get this close to a horse again. So actually it was another kind of unexpected win with the activity that actually we were able to make his dream come true. We have the next slide, please. And in terms of risk management as well, sometimes we do occasionally have unexpected challenges. And in this situation, the activity this day was needle felting. And we try with all our activities to be fully inclusive, and you only need a desire to actually join the session. However, the challenge in this particular case was actually the person that came along was actually registered blind, but was very keen to join. Now, if anyone on the call has actually done needle felting, it does require the use of a very sharp shard of metal, a needle, and the wool, and it's kind of stabbing motions. So how we managed that was actually I sat beside the patient and helped and guided and supported them. And this is a photograph of what they actually produced that day with support. And they were so proud of this Christmas pudding, this felted pudding. They actually brought it back and actually hung it on the window pane of their door for everybody to see, and they really relished all the compliments that they were getting from that. But also it was around the sensory feedback for that individual and that sense of accomplishment in that activity, which was just amazing. Next slide. And this was one of my favourite activities too. This was Pat Winslow, who was one of our poets that used to come in and do lots of different workshops with patients. And this one, we done something different this day. It was called Tales by the Fireside. And we actually had a 4D projector, and we projected the fire onto the wall. And the projector was also had sound, so we had the crackling fire sound emanating around the room as well. And what we did, we took it in turns to build a story. And what Pat did was actually gave everybody a hat, and we can see that on the next photo. And everybody had a hat. And what was really good with this session was actually people started taking on the characters of the hat as well to add to the story. And that was a really great session. And what we came up with as well, the story, and it was fed back to, was retold back to the patients at the end of this session. And actually one of the unexpected things that came out of that session was actually everybody started feeling very warm from the fire. So some of the other work that we have done as well, we've done some outreach work. We've done a lot of, during the first 3 or 4 years, even earlier this year, we were doing outreach work. So earlier this year, myself and Angela were preparing, if you see the top photos there, we were preparing some of the young people in a sixth form who were going to come and join our artists working in a local community hospital. And part of the prep work with working with the students was actually myself and Angela going, and I delivered a dementia friends session, but also it's about, you know, helping them understand what they might see, what they might hear within the hospital environment. So, you know, we're very conscious that actually, you know, it can be a very strange environment for those young people. And actually, you know, it was really important we prepared them well. So the dementia session, the dementia friends session went down really well, and they were actually really proud of their badges as well. And what came out of that day was actually several of those young people also had an experience of family members with dementia, and they really got to, a lot of them hadn't shared that story with their group of friends either. So that was a good opportunity for them to have those kind of interpersonal discussions with their peer group as well. The younger photograph is we had nursery school coming into the community hospital and doing arts and crafts. And, you know, I really don't need to add the photograph there, and the smile between those two kind of says it all, and how valued that was for them. And, you know, that's just a small example of some of the outreach work that we have been doing over the 4 years. So we've gone to day centres where people with learning disabilities and dementia are also cared for in the day. And we've also done some outreach where people with post-diagnosed dementia as well. So we've gone and done some support work with them as well over the 4 years. Next slide.
So during 2020, Creating with Care has continued to be innovative, delivering arts-based activities in what is a challenging time for everyone to ensure the well-being of patients and staff continues. We've facilitated virtual activities, so you can see in the top right-hand corner here, the Mary Lou review coming virtually to patients' bedsides. We've had garden concerts, we've provided creative packs and art carts for each ward, and we've also continued to do one-to-one sessions in dance with patients, but also supported patients with virtual calls and visits to their family. Staff have also been able to access activities to boost their morale during this time, increase well-being and reduce stress. Next slide, please. This is a picture here of one of our artists who Whitney and Abingdon College supplied for 8 weeks virtually into City Community Hospital, and he taught us virtually how to paint several things, and the sessions were just really valued from everybody who took part. Next slide, please. So this is a lovely chalk drawing here that one artist came and did of a dance session. So during dance sessions before COVID, we'd blow feathers to each other, and she captured this beautifully in chalk. What I wanted to talk about though for this slide is a session that I delivered during COVID with a patient who was particularly depressed after a car accident. It started with a discussion about music, and this lady loved classical music, and we both decided we'd quite like to listen to The Lark Ascending by Vaughan Williams. So I sat opposite her in full PPE and we mirrored each other's movement to music. After some time, she reached out her fingers and our fingertips touched, mine in my gloves. And she hugged herself, and I copied this. Then she started crying and said she'd forgotten how much she missed being hugged by someone else. I really wanted to touch you then, she said. We then held hands until the end of the music and talked. She said that she felt so much better afterwards and had been holding on to a lot of stress since the accident. The following day, we had a musician in the garden, and she was able to come to the day room, and she could hear and see more clearly what was going on in the garden this way. Staff said afterwards that it was the first time that she'd left her room, and she was really pleased that she was able to join us for the session. Next slide, please. So this is just a picture of one of the concerts that we had in the garden over the summer at City Community Hospital, and staff are still talking about these concerts 5 months later. So we're planning to have some carol singers in the garden later this week. Next slide, please.
So one of the things I want to talk to you about is really to think about the last year, and for you to think about some of the creative outlets that you became aware of, especially during lockdown. I know I certainly became aware of people baking and creating, people were sewing, and there was lots of paint, and there still is lots of painted rainbows around in our neighbourhoods. People were knitting and crocheting, and there was lots and lots of outlets. And if you think about patients in hospital, and and not having an outlet in terms of being able to pass time, how different lockdown may have been for people. I think it really shows the value of having these opportunities more than ever. I think people have found time to discover new creative activities, or actually, pick up things that they may have done years ago. And actually, when lives get busy, these tend to get lost, and people have really valued these. I know one of the nicest things I became aware of was actually I seen a lot of TikToks created between Judi Dench and her grandson, and that was just absolutely fabulous to see that intergenerational on technology as well, and how well that was played out over social media. So that there was lots of things, lots of creativity that was happening, and I think now more than ever going forward, as we recover from the impact of COVID, our staff, our patients, their carers, and you know, think about our mental health and, you know, our patients and staff, their mental health, that actually it's as important and more than ever going forward into next year that we continue to have opportunities available for everybody, really.
So building on what we have done over the past 4 years, we want to develop this more, have more opportunities for patients staying at our community hospitals, but also to develop the offer to staff, and particularly after the past year, to really increase what there is for staff wellbeing. So we're hoping to have a staff art club, which will be in addition to the new virtual staff choir that has been started by the Community Directorate recently. And we want to develop just more opportunities for staff to be involved. Next slide, please. We also want to ask for more volunteers to come and help us on the ward. Here's a picture of a couple of our volunteers who have helped over the past year, working one-to-one with patients, and they also, the staff, the volunteers have access to our art cart, which has lots of individual ideas and conversation starters. But sometimes our volunteers bring their own skills, like the one in the corner of the picture here with her guitar singing for patients. Next slide, please. So we just want to say thank you for listening, and I think we're handing over to Emma.
Thank you, Angela. So I just want to say a couple of comments really before I open up to questions. Wow. So one of our senior matrons very recently described this project as bringing therapeutic joy, and I think the two of you have absolutely demonstrated that through that session. The calibre of artists and the volunteers is just phenomenal, and I can really tell, and I can see from being on the wards, that this wide-ranging programme touches everyone of our patients, our families, our carers and our staff, and the impact is really palpable. So thank you, and thank you to everybody that's really involved in this programme, because it's just amazing. So I'm going to hand over to Katrina now, who I think is going to lead us through the question and answer session.
Just bear with us for some questions from Katerina in just a moment.
Sorry, that was my mistake. I was on mute. So I think I'm going to pass this first one to Angela. This is from your fellow governor, Mike Hobbs. And Mike says, this is inspiring and very moving. What activities can staff access and how many have done so?
Hello, Mike. I have totaled over the 4 years, we've had 1,666 staff attendances at projects. A lot of the time staff are joining in with patients, so it's not strictly a staff project. So we want to develop what we're doing for staff so that there are things for staff. We have at Whitney run dance sessions during lunch hour. And we've had some fantastic mosaic sessions for staff, both at Whitney and Didcot, where staff have been able to take time out of their day to just have 5 minutes of mindfulness. So in the future, what we want to do is have some kind of staff art club that we could maybe send out mosaic kits to staff that they can do at home, and then maybe post onto some kind of group blog, but also have an offer like they have with some other hospitals where they are looking at having offers for theatre productions and things like that. So in an ideal world. Okay.
Thank you, Angela. Sounds very exciting. I think the next one might be for Emma, and this has come in advance from our audience, and it is could similar program be extended to other settings, for instance mental health?
Thank you. Yes, so this programme, there is a similar set of creation that runs across our mental health wards and our teams, and I know Angela and Paula work particularly closely with Tom and other people that run that programme, so that is in place already, and the skills and expertise of those two sets of people coming together is just really exciting to watch how they're growing that. So absolutely, it's definitely on the plan, and yeah, and work in progress.
Thank you, Emma. And next, I think is again for Angela. If an artist or community representative wanted to get involved, how could they do it?
Okay, so in normal times, I really like to see any of our artists who are going to work with patients, see how they work with patients, and so I would definitely go along to maybe one of their sessions in the community to have a look at how they're working with other people, or maybe book them for a taster session at the hospital, so that we could kind of work out how that art form is going to work in a hospital setting, that sort of thing. And then volunteers, anybody who's come forward to volunteer with Creating with Care has to go through the Trust's volunteer process, but once they're approved volunteer, we usually are able to find them a regular slot to work with patients and myself at one of our community hospitals.
Thank you, Angela. And next one I think would be good for Paula. How do you make sure that everybody can take part?
Okay, so the ethos of the programme has always been to try and be as fully inclusive as possible. So a lot of our patients in our community hospitals also often and very frequently have additional needs. So actually what we do is actually assess the patient and assess the activity, and if they need that one-to-one support to join the activity, we try where possible to ensure that happens, to make sure that they feel supported. If for any reason that they want to join an activity and are unable to because they may be on bed care, or because there's an infection control reason and they need to stay within their own room, well then we have to think about a further assessment and actually consider if it's safe to bring the activity to them. And where possible, we always try to do that. And we try to, you know, with the appropriate assessment and PPE, we'll try and bring the activity into them. So yes, we have lots and lots of challenging situations. Patients, you know, who, you know, even with you know, very dense strokes and lots of additional needs, we've been able to bring into group dance sessions and include them. You know, we have that will, so we generally and quite often find a way of being inclusive, bearing in mind though that actually if that person needs that one-to-one additional support, we try where possible to provide that. And if for whatever reason we can't, then we can actually often in normal times we'll invite a carer or family member to come in, because actually if family members and friends are there, we will often try and involve them in the activity as well, because actually it just enriches the hospital stay as well.
Thank you, Paula. That sounds really, really admirable. And we also have a question from our audience, which I think this is maybe for Emma. Is there a separate or similar service for children and families?
Thank you. So there is absolutely some arts and some creative work that goes on in our inpatient settings for children and young people. There is not something similar that happens that we deliver anyway in our community teams from a children and families perspective. So a bit of a mixed answer there. Definitely for our inpatient beds, but not for our community children and family services.
Thank you, Emma. And the next one maybe for Angela. How do you share what you have learned with other organizations or other teams in the trust?
Okay, so oh, have I gone? I've lost a bit of connection there. How do we share things? So every year I write an annual report which gets shared to all of the trust. There's also these are also published on Oxford Health Charities website, so you can have a look on there. I think Katerina's going to put up some links at the end. We also write press releases for each project that we do, and get earlier this year I had an interview on BBC Radio Oxford, so we're talking through the press to the community about what we've been doing, and in terms of research, the evaluation report that Paula talked about was published and had been sent to various places to share what we've been doing, and that would have gone to the authors of the all parliamentary report that Paula talked about as well. So there you
go. Thank you, Angela. Like Angela mentioned, I'm just putting into this Q&A function some of the links where you can find out more about the program, and I think that's about all that we have time in terms of questions, so I am going to pass on to Emma. And before I go, I just want to wish everybody a very, very happy and lovely festive season.
Thank you. So in order to sum up, I just want to take us back to the patients that we heard about in the presentation there. So there was lots of patient examples and lots of visuals that you could see where patients were really engaged and enjoying this programme. The two that stood out for me really were the gentleman and the horse and the lady in the PPE, and that was a real example of where Angela managed to unlock that lady's inner spirit and to develop a confidence and a trust in us as a caring environment for her to release her potential. And that was just a really moving account of the impact this programme really has. In 2020, we've never needed a programme more than we need this one. So this is really, we've seen some of the creation and the way that the programme has delivered, and you heard that the staff at the City Community Hospital are still talking about those outdoor concerts, and they will be talking about the carols in the courtyard as well later on this week. So I'm really grateful and really want to just express my thanks to everybody, Paula, Angela, and everybody involved in this programme. It is amazing, and I hope we've shared that with you. A further reminder that we are looking for members for the trust, so you can do that via the website, and the information is there in the chat for you as well. And just to echo the my best wishes for the season as well, and thank you very much for joining us this afternoon.